Now, where is the worst place to be a mother? Our health correspondent, Linord Moudou, is here with some answers. Welcome, Lino.
Welcome, Vincent. Welcome, everyone. Well, according to Save the Children, the Democratic Republic of the Congo is the worst place on the planet to be a mother. Save the Children looked at 176 countries around the world and found that in the DRC, a woman or girl has a 1 in 30 chance of dying during childbirth or from related conditions. The Mother's Index, as it's called, examines indicators of maternal health and child mortality, as well as levels of women's education, income, and political status. Finland ranked as the best place to be a mother. The risk of death there is just 1 in more than 12,000. Now joining us in the studio is Dr. Alfred Bartlett, the director of the Saving Newborn Lives program at Save the Children. Dr. Bartlett, welcome to the program.
Thank you, Lino.
So first of all, let me mention that this report, the Mother's Index, is part of the bigger report that focuses on children, and the focus is surviving the first day. Why was it important to focus on children this year?
Well, Lino, every year, Save the Children publishes in the week before Mother's Day a State of the World's Children, or State of the World's Mothers report, which is this. And every year we have a different focus on things that are important to women as mothers. This year the focus is on something that has really been somewhat neglected, which is the fact that what every mother wants is a healthy baby. And in many parts of the world, that's not what they get. Actually, newborns have been left behind in the progress we've made in saving children. We've made tremendous progress in child survival over the years since 1990. But in fact, we really haven't paid as much attention to newborns. So the first month of life, which is the newborn period, is actually the riskiest time in a child's life. And the very first day of life is the riskiest day in any child's life. 1 million children die in the world on the very day that they're born.
That's a very staggering number. Now, what are the recommendations in this case, briefly, to allow that these children grow to become older?
Exactly. The most important thing is the care that mothers get during their pregnancy, during labor and delivery, and the care that the baby gets immediately after being born and during that first month of life. We have now identified 3 major things that basically are the causes of almost all of the babies that die in that newborn period in the whole world. They are babies that are born too soon, that are preterm, babies that do not take their first breath, even though they're alive and kicking when the mother goes into labor, they don't breathe, and infections. Those are the 3 things, and we now know how to deal with all 3 of those things.
Okay, and now another part of the report, which we mentioned earlier, is the Mother's Index. And when we saw that, the DRC ranks this year last. So what is happening in the case of the DRC? Last year it was Niger, now the DRC. What is happening here?
Well, 2 things happened. One, we simplified the index a little bit. There were some extra indicators in there that kept us from having data on some countries. So now the index has 5 major pieces that are related to the health of mothers and their babies. They're the rate of survival of mothers, the rate of survival of children, the economic situation of mothers, their education, and their access to political power. Those 5 things are now the index. So some of the change is explained by that. But the difference between Niger and DRC is probably not a very big difference. The bottom 20 countries in the Mother's Index are all in sub-Saharan Africa.
That's very, very scary. Now, the good news is Finland is first. So what can we learn from Finland? What are they doing right?
Well, in Finland, there's obviously a strong commitment by the government to the well-being of mothers and children. They also have a very well-organized health service. And then those other things, the education level, the economic access of women, the political representation of women in their parliament are also very strong. And so when you add all those things up, Finland comes out on top.
Well, that's good. At least hopefully we can learn from that. Thank you so much, Dr. Bartlett. That's all the time we have.
My pleasure. Thank you.
And that was Dr. Alfred Bartlett with Save the Children. And that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com.